Okay, for this section we're going to talk about threats to construct validity. And I know you've read the threats to construct validity, so what I'd like to do is just touch on a few of those threats and how we manage them. So I'll do a little bit of description, but talk a little bit more about how we can manage some of these threats. So here are the 5 threats that I'm going to focus on. It's not all of them, but it's kind of ones that are most important or most often come up. That is, of course, depending on what you're studying. But we'll talk about the inadequate definition of the constructs, mono-operational bias, mono-method bias, hypothesis testing, and experimenter expert. So the first one is, the inadequate pre-operational exposition of constructs, which I think is kind of a fairly descriptive but kind of horrible name, because it doesn't really point out what the problem is. Really, it is we didn't clearly figure out what we were looking for before we started. So we kind of jumped in and then after the fact said, oh, wait a minute, I'm not sure that's exactly what we meant. Or, even more unfortunately, we never really figure out that what we measured was not really a good measure or a good way to link back to the construct that we were trying to measure. So, my example here, we want to know if our customers are happy. Well, what does happy mean? Does that mean they're satisfied with their product? Does that mean they repurchase from us? Does that mean they come back to the store? Does that mean that they're an advocate and tell other people? We really have to define what that is. And a lot of times we do have that gap in that space where we kind of think that it's assumed and clear that everybody understands what we mean by our customers are happy, but we really haven't defined that. So we'll put together a survey and ask them if they're happy, but it doesn't necessarily get us the information we want, because we may try and do some things or make some changes or make some improvements, and it doesn't lead to greater sales. It doesn't lead to greater advocacy for our products. So there's a very strong need to make sure we understand and are clear with ourselves and with other people how we're looking at this construct, what it means, and how we're going to measure it. Once we have that settled, now we have to look at how we go about really manipulating or measuring a construct. And this does apply, all these do apply both for constructs that we're manipulating as independent variables and those we're measuring as dependent variables. I'll probably talk more about them as the dependent variables as measures, because those examples are a little clearer, but they apply both ways. So mono-operational bias means we only have one way of kind of operationalizing a construct, and it's not complete. Okay, so I'll go back to my example about if we look at the success of salespeople. Again, if we only operationalize that as success as how much money they make, how many sales they make, that is one way of measuring sales success. But there's a bias in there. And that bias is that we're only looking at the dollars that go to the salesperson. So other things that might be meaningful or might be interesting or might need to be in that definition and that operationalization is, were customers happy? Were the sales profitable? And that one's actually kind of a realistic one, because a lot of sales rewards programs are based on the number of sales people make, but salespeople can sometimes manipulate or reduce their commission a little bit, or reduce the sales price and keep the same commission. And sometimes they'll pass through a bunch of sales that aren't profitable. Well, the organization's really more interested in profitability of those sales, but because they've kind of mono-operationally, one way of incenting the salesperson is by giving them a commission for sales, not profitable sales, because they've had this one-dimensional view of it. They tend to get a lot of sales, but not all of them are profitable. And I've worked with number of clients where they've run into that issue that, yep, we're generating a lot of sales, but we're not making any money. And it's because the way we've incented and the way we've defined that incentive has a bias in it based on the way it's operationalized. Next one is mono-method bias, and it has a lot of similarity to mono-operational bias, except it is in a lot of times, where we're getting that data from or where we're getting that information from. So self-report is one methodological way to gather information about people. So if we want to assess employee engagement, how engaged they are, if we only ask people about how engaged they are, then we only get their perspective. And that, if you go back to think about some of the challenges with that, people can be self-delusional. They just don't know that they have a bias, or they can be self-promoting. I want to make sure that I look good. I don't want to say that there's something wrong with the organization, because I like my job, at least for now, and I want to keep it. So there are biases in the way that we do it. So if we rely strictly on self-report, we have those biases. If we rely strictly on archival data, we have biases that are built into the archival data. Somebody last week had an example in the discussion board about basketball games at SLU, at the Chaffetz Arena, and one way to, I think the thing that was being measured was kind of the environment, or the enthusiasm of the crowd, is kind of what I remember or take away from it. And you could certainly survey people and ask them how enthusiastic, excited they were. You could also measure the amount of noise in the stadium, and that might be a measure or a different operationalization of how excited and engaged people were in the events. So you're looking there then at two methods. One is self-report, and one is actual data or information. In doing that, you get a triangulation. You get a stronger level of confidence, or high level of confidence, that what you're looking at, or what you're using as your measures, truly reflects the construct that you're considering, and therefore you have higher validity, or higher ability to draw for conclusions from that. So, monomethod bias. On mono-operational bias, I'm going to back up one for a second. Ways we control that is, again, kind of making sure that we have a number of operationalizations. The way that we think about the construct, we take a couple of different approaches to defining it and measuring it, and add those together, or sum them up, or average them, bring them together somehow, so that now we have multiple measures, or multiple operationalizations, to really sharpen the accuracy of how we're measuring or manipulating a construct. The next one is hypothesis guessing. Participants do try to guess sometimes what we're looking for if they know that they're in a study, and they act differently. So I have an example down there of folks who are in a pilot program getting to success. They work harder, report better results. They give us more information back because they've guessed what we're trying to do, and they try and help us out. They don't always try and help us out, but a lot of times they will try and comply, because there's what's called a demand characteristic. I'm in this program. This program is here to help me. I should get something out of it. So there's a social dimension, a social push to give back what the researcher is looking for. So if folks can guess what the hypothesis is, they may act differently just because they're trying to satisfy the researcher, right? It could go the other way. If they don't like the study, or they feel left out, you got that demoralization piece from internal validity. They could go a negative direction as well, but they're going to change their behavior because they've guessed what you're trying to do, and then they're trying to make a decision to either help you or hurt you in doing that. And then the last one that I'm going to talk about are experimenter expectations. And actually, before we go on, I'll talk a little bit about how to manage the hypothesis guessing. As much as possible, we want people to be blind to the study, right? We don't want them to know what our hypothesis is or what we're trying to do. Now, that runs afoul of informed consent, which we'll talk about in ethics later. So we have to find ways to balance that and manage the space between those two. But as much as possible, we want people to be blind to the condition they're in. So maybe they understand what we're trying to do or what we're trying to study, but they don't know if they're in the treatment condition or the non-treatment condition. We want them to really come into that from a novel perspective. So if you think about drug studies, you don't know if you're the group getting the placebo or the one getting the new drug. And that's so we can manage that guessing and say, well, I do feel better because I'm getting the new drug, and so I feel good about it. So that is ways to manage hypothesis guessing. When we talk about the last one, experimenter expectations, the results are influenced by the researcher's hunches about the outcome. So single blind is the subjects don't know what condition they're in. Double blind is the researchers don't know, because it is possible that subtly we treat the groups that are in one condition, or we treat the participants that are in one condition differently than we treat those in the other condition, and especially the difference between the control and the experimental condition. So I would really like to believe that my theory is right, that what I've been studying for years does have the impact it's having. So when I do the research, I subtly give cues, give help, give influence to the group that kind of backs my theory, what I believe, and so those expectations then shift the outcome and reduce our validity. Clearly, the easiest way to manage this, and the way that is kind of the most common one, is what we call the double-blind study. A minute ago I mentioned single-blind. The subjects don't know which condition they're in. Double-blind, the experimenters don't know which condition they're in. And if you look at all the medical research and the pharma research, a controlled double-blind study is their gold standard. So the physicians giving the treatment, the nurses giving the treatment, don't know whether the patient is getting the new drug or the placebo, and the patient doesn't know if they're getting the new drug or the placebo. And that's to control for those subtle cues and nuances that may impact the outcome and the results. So those are the threats to construct validity, and a little bit about how we can manage them. They're fairly straightforward and fairly easy to understand. So they can be managed, and we can do quite a bit to increase the construct validity of our studies, both on the measurement side and on the manipulation side of different treatment groups.